Order. We now come to the backbench debate on National HIV Testing Week. I call Charlotte Nichols to move the motion.
Thank you, Madam Deputy Speaker. I'm the understudy today for the Right Honourable Member for Dumfriesshire, Clydesdale and Tweeddale, who secured this debate. Madam Deputy Speaker, it has been 42 years since the untimely death of Terence Higgins, who was not only the first recorded British person to die of HIV/AIDS, but a Commons Hansard reporter. Since then, we have made huge progress in the testing, diagnosis and treatment of HIV. Today, people living with HIV can continue to live very normal lives. It's essential to remember, however, that HIV remains a critical global health issue, with millions of people living with the virus and many more at risk of infection. Early diagnosis and treatment of HIV is essential in reducing the spread of the virus, improving health outcomes and reducing the stigma associated with the disease. Charities such as the Terence Higgins Trust, the National AIDS Trust, the George House Trust and others who have worked tirelessly to lead the fight against HIV, I thank for the phenomenal work they have done and continue to do to help those living with HIV and to continue to achieve the goal of no new HIV transmissions by 2030. I would like to take the time on behalf of all of the members of the All-Party Parliamentary Group on HIV and AIDS to thank the outgoing Chief Executive of the National AIDS Trust, Deborah Gold, for her hard work and dedication to the charity for the last 10 years, and for her immense contribution to the fight against HIV, and I'm sure everyone will join me in wishing her all the best of luck in her new chapter. As members will be aware, HIV weakens a person's immune system and their ability to fight everyday infections and disease. HIV is passed from human to human and, if left untreated, can progress through a series of stages leading to acquired immunodeficiency syndrome, or AIDS. Though there is currently no cure for HIV, there are treatments available that enable a person to live a long and healthy life. A person living with HIV has a similar life expectancy to a HIV-negative person, provided that they are tested and diagnosed in good time. We saw in 2022 the government introduced the National HIV Action Plan. It had the clear aim of reducing new infections by 80% by 2025 and, crucially, ending infections and deaths from HIV by 2030. We know that this goal can only be achieved if the plan was properly financed and implemented. In November, at the event organised by the APPG on HIV and AIDS and hosted by Mr. Speaker to honour Sir Elton John, Victoria Atkins, Secretary of State for Health and Social Care, outlined that the UK government would be expanding the hugely successful NHS opt-out virus testing programme for HIV and hepatitis to 46 new emergency departments across England. Expansion of the programme from the current 33 sites to every high prevalence area could identify a significant proportion of the estimated 4,500 people living with undiagnosed HIV, prevent new transmissions and save more lives. As members will know, this week across the country, including on the parliamentary estate, we've been marking National HIV Testing Week with a number of events to raise awareness of HIV testing. This annual campaign aims to raise awareness of the importance of regular testing to reduce the number of people living with undiagnosed HIV and those diagnosed late. This year, the campaign's new strapline, I Test, is in its second year. I urge everyone to take advantage of the services available during National HIV Testing Week and throughout the year to get tested and to know their status. Madam Deputy Speaker, the recent UK SHA data highlights that while we're seeing falling HIV diagnoses amongst white, gay and bisexual men, inequalities are deepening. HIV transmissions have increased in the last year amongst heterosexual men and women, as well as gay and bisexual men of other ethnicities. Persistent inequalities must be overcome. At the same time, the experience of people living with HIV is not equal or equitable. Concerning numbers of people living with HIV are afraid to visit healthcare settings, with women and people of Black African ethnicity being more likely to be afraid than men or people of white ethnicity. These inequalities are mirrored in the experience of people offered an HIV test. 40% of women eligible for an HIV test were not offered one when attending a sexual health service. I'd like to urge the Minister to do everything that she can to tackle the inequalities in the HIV response that we see in order to deliver the government's action plan and end new transmissions by 2030. Along with tackling inequalities, we need to tackle the growing number of people previously diagnosed with HIV who are lost to care, previously diagnosed with HIV but not accessing the care that they need. UK HSA estimates that as many as 14,000 people living with HIV in England have not been seen by their HIV clinic for at least a year, often for complex social and stigma-related reasons. They're essentially lost from the health system. 1 in 3 of those testing positive for HIV through opt-out HIV testing in accident and emergency departments know about their status but were not accessing care. And hospitals in London are now reporting that people lost to care have overtaken undiagnosed HIV as the leading cause of HIV-related hospitalisation and mortality. These are entirely preventable incidents. Pilot work in South London, funded by the Elton John AIDS Foundation, has shown that with case finding, focused follow-up and wraparound support, people can be successfully returned to care at an average cost of £3,000 per person. HIV clinics currently do not have the resources to do this work, but it is significantly cheaper than care costs when people develop a serious illness. A national programme must be urgently introduced to find everyone lost to HIV care in England and ensure that they're getting the care and life-saving treatment that they need. So can the Minister confirm today what action the government is taking to find people living with HIV who have been lost to care? Finally, we must tackle the issue of late diagnosis. Madam Deputy Speaker, certain groups are also more likely to be diagnosed late and therefore experience worse health outcomes. 44% of people diagnosed with HIV in England last year were diagnosed at a late stage, and late diagnosis rates are even higher for women at 51%. The number of people living with HIV who know their status but aren't in care could be higher than the number of people living with undiagnosed HIV. This is a risk to their health, expensive for the NHS, and threatens HIV elimination. People not in HIV care are disproportionately from underserved communities, including black communities, women, and people who use drugs. The impact of late diagnosis can be extremely damaging. As well as meaning that people might unknowingly pass on the virus, if someone receives a late diagnosis, their chance of dying in the first year after diagnosis is 10 times greater than if they had received an early diagnosis. Additionally, late diagnosis can have a detrimental impact on an effective response to treatment, which in turn leads to greater healthcare costs at a time when there are already financial strains on the NHS. Late diagnosis is particularly common among certain groups. 54% of heterosexual British Black Africans and 29% of gay and bisexual men were diagnosed late. Opt-out testing has allowed us to identify that those groups are the most likely to be HIV positive. Although opt-out testing highlighted that these groups were most likely to have HIV, we need to encourage more people from them to get tested. A simple solution to encourage more people from those groups to get tested could be to use public message campaigns. Targeted messaging across radio, television, and social media could be created to encourage people to come forward and get tested. It could also specify the importance of testing and tell people where their nearest local test centre is. Ultimately, in order to address late diagnosis in both primary and secondary care services, HIV testing needs to become more prominent across the entire NHS primary and secondary estate. If we want to turn the UK into a science and health superpower, and if we want there to be no new cases of HIV transmission by 2030, it's essential that we address the issues that I'm highlighting today. In particular, it's vital that we rapidly increase testing levels in high and very high prevalence areas through opt-out testing. That will not only save the NHS money and reduce the backlog, but it will enable patients to know quickly whether or not they have HIV. My challenge to the Minister today is for her to fight the corner, to fight the inequalities within the HIV response, ensure access to testing is increased, and ensure that once testing has started in these hospitals, funding for testing will continue until we find the last person living with undiagnosed HIV in England. The opportunity to eliminate new cases of a long-term condition is rare, yet we have the tools to do just that now. We must grasp that opportunity and create a culture where failure to follow guidelines is considered wrong and HIV testing is considered routine. I'd like to end on this note, Madam Deputy Speaker. It's crucial that HIV and AIDS remains firmly on the agenda of our governments, both domestically and internationally, who must be held to their promise to reach 0 new infections by 2030.
Yeah. The question is, as on the audit paper, Father of the House, Sir Peter Bottomley.
Madam Deputy Speaker, at the conclusion of this debate, I'm going to take an HIV test. I don't expect it to have a surprising result, but I think unless people like me can set an example, we can't expect others to overcome what might be embarrassment or awkwardness. And the same thing applies to things like giving blood, which I did again this morning for over the 90th time. If people watch blood being taken, they'll be less fearful about doing it themselves. And if they know that people can take HIV tests without embarrassment, they can do the same thing themselves. There are about 3 million of us each year who go to sexual health clinics, and there's a lot of acronyms, STI, STD, GUM, HIV, AIDS, all these kinds of things are there. And they all follow either from things like blood being given. The first person in my family to take an HIV test was my mother, who had had a massive number of blood units given to her after an operation, and she wondered whether she was infected and might infect others in the family. She was clear. Many were not so fortunate. For those vectors, that's person-to-person transmissions, we ought to be far more open that the only thing we can't inherit from our parents is celibacy. Sex is common, it can be adopted, it can be forced on you, and so celibacy can be adopted or forced on you, but it's quite common for the rest of us. And with that, we know that they have vectors like genital warts. I'm glad that we've now got vaccinations against that, including with the cervical cancer, and it's available to young boys or men as well, because you can get herd immunity much faster if both sexes are involved, and you also give protection to those who only have sex with men. I'm not an expert on all these things, but I do believe that we ought to be as careful about this as we are about trying to make sure that we have people's teeth protected, as we were discussing yesterday on dentistry, as we do in being concerned that the chances of being involved in a conception which ends in a formal termination is about 50% in this country. If you have a birth cohort of just over 600,000 and you have over 200,000 abortions a year, it takes 2 to tangle, the maths is not very complicated. And if you could get people to realise that it is possible, as the Honourable Lady has said in her remarkable, positive, important speech, we can end transmission of HIV if people know if they've been exposed to it and if they know they're getting treatment for it. This is not a reason for a long debate or even a long speech from someone like me. It is to say, in solidarity with people who we can protect, we ought to know our own status, we ought to encourage others to find ways of discovering their status, and we ought to make sure help is available and offered. I found it very odd that in many times when people do come into contact with the medical services, clinical services, they're not offered and encouraged to discover their status in all kinds of ways. Because modern treatments are available, they're effective. I think if we can overcome the embarrassment, we can get to a situation where people can be themselves, live as they choose, without being a risk to themselves or risk to others. Can I thank the Honourable Lady for her speech, and I hope that the whole country will pay attention.
Andy Slaughter.
Thank you very much, Madam Deputy Speaker. Pleasure to follow the Father of the House, and also thank my old friend for Warrington North for so clearly setting out what the issues are. I don't need to repeat that. I just want to speak briefly. I represent a constituency that has had for many years high incidence of HIV infection. It has a young, it has a mobile, it has a diverse population. It has a very busy sexual health clinic at 10 Hammersmith Broadway, which I visited last summer. And I just want to first of all pay tribute to all the staff there and at all the other clinics around the country. They offer a fantastic service, and they are engineering as far as they can the testing and the comprehensive treatment under very difficult circumstances and with very limited resources. And I'd also like to pay tribute to Timothy Higgins Trust and the National AIDS Trust and all those other charitable organisations that have done so much over the past few decades. We should pause, I think, in this debate and just mark what successes there have been and what the transformation has been in both the prevention and the treatment of HIV and AIDS over the past relatively few years. It is a great success. We do know now that that early diagnosis is important, but that after diagnosis, then those who are infected can live normal lives of normal durations in that way. That would have been unthinkable, probably even 20 years ago. We do know that there is, through PrEP and other methods, there are very effective prevention, and to go from where the risk of infection was a few years ago to where we are now is also extremely significant. So it's in a way even more frustrating, given that the testing is available, that treatment is available, that prevention is available, or rather should be available, that we're in the situation that my honourable friend has outlined. Firstly, the fact that there are 4,500 people undiagnosed in the UK, that's entirely unnecessary. And there are solutions. One of the solutions, which is now being expanded by the government, is opt-out testing in A&Es and other locations. But that really needs to be embedded there. It really needs to be extended. And until we get to the stage of having prevented transmission altogether, and the ambitious target there is for doing that, that needs to be expanded, made more usual, and that in turn will enable the disparities in testing rates between different parts of the population, between men and women, between heterosexual and heterosexual men, that will be also eliminated in that way. This is not rocket science. This is simply making sure that the proper remedies are available. The other issue that has come up repeatedly over the last couple of years is the availability of PrEP and the availability of preventative measures. Now, partly that is because the pressure on sexual health clinic that has come through an upsurge in other STIs, through gonorrhea and syphilis, which we've seen not quite epidemics but serious outbreaks of monkeypox last year and several episodes of that, which have understandably taken the priority of time in sexual health clinics, but mean that there is less time available to see clients for consultation, and that there is less prescription of PrEP and other medications in that way. And there are very long waiting times. There are still far too long waiting times, but they were at one stage being measured in months rather than weeks. That is so clearly a missed opportunity that people who are willing to be prescribed PrEP, who understand the advantages of it, are nevertheless not receiving prescriptions because they simply cannot get an appointment at their local clinic through no fault, I say, of the clinic or the clinic staff. These are the problems that need to be tackled. They're relatively inexpensive to do. They're relatively clear and straightforward. These are safe, tried and tested drugs and products, that whether it's postal testing, whether it's testing in A&Es, whether it's outreach, that all these are methods that are well known and proven to work. And the only issue therefore remains, and I hope the Minister will address this in replying to the debate, is why isn't it being done? Obviously there were problems during COVID, as there were with many health services, but that is no longer good enough as an excuse. There is no reason why people should not be able to readily access testing and readily access medication and preventative measures in this way. And I'd like to hear a further commitment from the Minister today. I'd like to hear that in relation to opt-out testing. I'd like to hear that in relation to resources for sexual health clinics and indeed the availability of PrEP. It has been suggested that given the expansion in services that are provided by pharmacies now, that PrEP could be added on to that. I see no reason why that can't be the case. It could be perfectly safe for it to be prescribed in that way. It would take the pressure off clinics and it would make it more accessible and easier for those who are not currently being prescribed to access it. So I'll ask the Minister and the Government to consider those points. They're not difficult to do. Won't take a long time to do, but they could have a significant effect for many hundreds of thousands of people who are unnecessarily at risk.
Jim Shannon.
Madam Deputy Speaker, and it's a pleasure to follow the Honourable Gentleman for Hammersmith, and I thank him for his contribution and his knowledge of his constituency and what he has said. First of all, I'd also like to thank the Honourable Lady for Warrington North. She and I were in debate yesterday on mindfulness and led the debate very well. Today she led the debate on HIV testing week, and also have to say did it exceptionally well. I'm a party's health spokesperson, so it's a pleasure for me to be here, Madam Deputy Speaker, to make a contribution. I always like to do, if at all possible, speak in this debate. Something that once or twice I have missed it, to be fair, and unable to do so, but today I'm very pleased to be here. And as I think we do celebrate the fact that HIV is now a disease that people can live with, can enjoy better life. I think that is something to celebrate. And on National HIV Testing Week from the 5th to 11th of February, I think special recognition for this year as it marks a decade since it started. So therefore, we look at what the last 10 years have done and how we've progressed and how we've done better and how people have a better quality of life today than what they had in the past. So it is important, I believe, to mark this week in Parliament as testing is the only way to know if you have HIV. The Leader of the House in his contribution referred that he was going to go and get a test, even though he doesn't need to get the test. But he's making the point that it's important for people to recognise that testing is important. Latest figures show that the HIV diagnosis is falling, but it does unfortunately show, Madam Deputy Speaker, that there are people of a heterosexual orientation who perhaps are getting more of HIV diagnosis, so there is a lot of work still to do. Testing is free, quick and easy, so it's imperative that people of all ages are aware of the services available to them and take advantage of these to prevent passing on to others. I would point the Minister, who I respect greatly and understand her deep interest in this subject matter, and look very much forward to her response. At the PrEP that the Honourable Gentleman for Hammersmith referred to, in Northern Ireland we've had a campaign on that for some time. Very successful campaign, by the way. Raises awareness, number one. It tries to reduce sexual diseases, number two, and by its very purpose then gives people longer life. In Northern Ireland, and due to the 2020 statistics, there were some 69,000 tests carried out for HIV. Of these, there were 52 new diagnoses, making the total number of people diagnosed with the disease 1,123. In a population like we have, you may say that's not bad for the figures, but I don't think it is, but it does illustrate that it's the HIV testing, it's the use of PrEP, and it's other things, that other policies that they have in the Northern Ireland, which has enabled to reduce it and keep it at a figure which is manageable. It is interesting to note that this is a decline of 49% from 2015 in Northern Ireland. So it's a really massive success story. There has been a declining trend in the annual number of diagnosed of people born in the UK. So there's no doubt that we are certainly doing our best in terms of encouraging people to partake in testing. It's also important, Madam Deputy Speaker, to recognise how far we have come since the 70s and the 80s. Where there was a huge stigma around the diagnosis of HIV testing and treatment. Excuse me. As many will know, I'm my party's health spokesperson, so these are debates that I try never to miss. and it's important for me and to see how amazing it is to see how far we've advanced both socially and medically. How wonderful that our NHS is at being capable of transforming a disease that was once much feared virus to something that is so easily treated. That doesn't mean we become nonchalant in relation to it. It means that we have to recognise what we've done and then recognise what our policy will be for the next period of time. People are much able to live long, healthy lives through treatment. I look to the Minister for a commitment that we will dedicate more resources to educating young people on HIV and other viruses that can be passed on through infected bodily fluids. Many young people will not be aware or even remember the years where HIV was a massive concern to so many. But it's also crucial today that we keep on raising that awareness and that they are encouraged to test if necessary and have those conversations with family, friends, and ensure that they don't have the disease and that they're safe and well and healthy. Where can we do that most of all, Madam Deputy Speaker? In schools and universities, they have a role to play in ensuring young people feel comfortable and have a safe place where they can speak to someone privately, because the Honourable Leader of the House is absolutely right. Sometimes these are subject matters which are difficult to deal with, and those conversations need to be private conversations sometimes. So when it comes to universities, where many already have sexual health clinics, which are a fantastic service to offer young people, so many organisations do incredibly hard work in providing support for other nations that have a high prevalence of HIV. And I want to make it's National HIV Testing Week, and I want to make this plea as well. One of my churches in my constituency, the Edom Church in Newton Ards, and they also operate the Edom Missions out of there. They've been incredibly active with missionaries in Africa, and especially in Swaziland and Zimbabwe. Every year, Madam Deputy Speaker, we have a group of young people who come to our constituency. Every one of those young children are HIV. Their parents had it, and but they're living a life today because of the new medications and the new medicines that we have. So I feel greatly encouraged when I see them, when I hear them singing, when I hear their quite heavenly voices, and it reminds me that we in this country, this great United Kingdom of Great Britain and Northern Ireland, have done magnificent work out in Swaziland, Zimbabwe and across Africa. I know it's not the Minister's responsibility, but if the Minister is able to maybe hint or perhaps write a letter to myself and others in relation to the work that can be done in relation to continuation of the HIV work in Swaziland, in Zimbabwe, where it is of great interest in some of my constituents who attend the local church there. At one stage, Swaziland had 40% of their population were HIV until they got the medications and they did the testing and their campaigns. Now today, it's manageable. Now, if that's not a success story, I'd like to know what is. Many will know in certain parts of Africa there's a high prevalence of HIV, and the Ministry is keen to secure help for young children and parents who are suffering. There is so much ambition to help others, as has been proven that caught early and frequent testing does hinder the spread and lessen the impact of HIV on an individual. So across the UK, we are successful in terms of our figures, so perhaps the Minister could provide some clarity on whether we are able to help others and other countries in desperate need as well. To conclude, Madam Deputy Speaker, this week is indeed another opportunity to encourage people to take advantage of services offered to help combat HIV. There is fantastic potential to protect people from HIV and prevent severe illness and even death. And I often think, and when I think of the royal family, I think of Princess Diana and the work that she did when she was alive, and reached out and was one of those great motivators and one who tried to make it sure across the world that people recognise that HIV for many should not and would not be a death sentence. So I want to send my thanks to the local health trusts in Northern Ireland, and indeed across the whole of the United Kingdom of Great Britain and Northern Ireland, for providing these worthwhile facilities. And I call upon the government and upon the Minister as well to ensure we can continue to ensure sufficient testing services to all across the United Kingdom of Great Britain and Northern Ireland. It has proven instrumental in saving lives, and why would you not want to celebrate an occasion like that, where across this great United Kingdom many people are alive today because of what we've done. Thank you.
SNP spokesman Amy Callaghan.
Thank you, Madam Deputy Speaker. I congratulate the Honourable Member for Warrington North for opening this debate today. My honourable friend was an excellent stand-in for the Honourable Member for Dumfriesshire, Clydesdale and Tweeddale, approaching the subject with nuance and good grace. Madam Deputy Speaker, I thank my constituents in East Dunbartonshire and for people right across Scotland who contacted me in advance of this debate today, which has helped me shape my remarks. I must also thank the Terence Higgins Trust for their very helpful briefing in advance of this debate today. Madam Deputy Speaker, just prior to Christmas, I popped into Charlotte Tilbury where I purchased myself a nice new lipstick, which I'm wearing today. The money for the sales of this lipstick go to the Rocket Fund, powered by Sir Elton John's AIDS Foundation, which seeks to end AIDS everywhere. Madam Deputy Speaker, I must say that I was delighted to be doing my bit just by treating myself to a new lipstick, even prior to this debate today. National HIV Testing Week serves as a reminder to us all of the importance of knowing our status, and it provides amplified opportunities for people who would otherwise never test to do so. The scientific advances in HIV treatment and prevention have been some of the biggest we've seen in modern medicine. An HIV diagnosis has gone from being a near-death sentence for sadly too many people to being a manageable condition, with people living with HIV enjoying a normal life expectancy. Even more incredibly, we can now say with absolute confidence that someone on effective HIV treatment cannot pass on the virus to their sexual partner. Undetectable equals untransmittable. One of the key interventions and milestones which contributed to this progress was the implementation of the NHS-delivered National HIV PrEP programme in 2017, and I'm proud to recognise here today that Scotland was the first nation in the UK to make PrEP available free to anyone at risk on our precious NHS. There are now approximately 6,000 people using PrEP in Scotland at any one time. An estimated 500 people are living with undiagnosed HIV in Scotland, and a further 961 people are diagnosed with HIV but are no longer considered as attending specialist HIV care. Reaching these people will be vital if we are to be successful in ending new cases of HIV by 2030. Between 2010 and 2019, the most marked reduction in the annual number of first ever HIV diagnoses in Scotland were observed among gay, bisexual and other men who have sex with men. These reductions likely reflect a decline in the incidence and transmission of HIV infection in Scotland associated with a range of public health measures over this period. However, that same progress is not happening across other groups, with slower reductions among women and minority communities. Other groups continue to be marginalised, such as sex workers and injecting drug users. Madam Deputy Speaker, the number of people with undiagnosed HIV in Scotland is thought to be larger in heterosexual individuals, emphasising the importance of considering HIV in people without identified current risk behaviours and the potential for greater impact of HIV-related stigma. Stigma still blights the life of far too many. We must continue to fight the stigma still experienced by people living with HIV. Stigma and discrimination remain a reality for many people living with the condition. There is a need to increase awareness, fight prejudice and improve education about HIV. That's why on the 1st of December 2022, the Scottish Government published their report Ending HIV Transmission in Scotland by 2030. To achieve the HIV transmission elimination goal in Scotland, a whole system and whole society approach will be required. The high-level activities required are primary prevention, detection and, of course, treatment. Indeed, National HIV Testing Week holds the opportunity to get tested, and it can even be done at home with a result in as little as 15 minutes. And I'm pleased to confirm today to everyone here that I have taken an HIV test as a heterosexual woman. I think that's an important step we as members of Parliament can do for our constituents to show them how important this matter is. Indeed, National HIV Testing Week holds the opportunity to get tested. The only HIV test to fear is the one that you didn't take. This is a privilege that so many in the 80s and 90s were never afforded. Globally, thanks to the investment of countries like the UK through aid in the UN Global Fund and research through IAVI into vaccines, we are seeing millions more receiving antiretroviral treatment and testing. In November 2020, the government announced aid spending would fall from 0.7% to 0.5% of gross national income as a temporary measure in response to the COVID-19 pandemic's effect on the UK's public finances and the economy. I'd like to express my concerns to the Government on the lack of recommitting to the 0.7% GNI spending on overseas development aid. I echo the comments of the International Development Committee chairs and reiterate her point on how the UK is failing on funding commitments and its ability to set or achieve meaningful targets on sexual and reproductive health. We have the tools to end HIV transmissions, we just need to use them backed up by the political will. While advancements in medical science have transformed HIV, the persistent stigma, discrimination and lack of awareness surrounding HIV testing remain formidable barriers in our fight against it. National HIV Testing Week serves a crucial reminder of the importance of early detection and diagnosis. So, Madam Deputy Speaker, as we commemorate National HIV Testing Week, let us reaffirm our commitment to end the silence around HIV, dismantling barriers to testing and saving lives. I would like to see a recommitment by the UK Government to ending HIV as a public health threat. By working together, we can achieve our goal of ending new HIV cases by 2030. Thank you.
Shadow Minister, Preet Corgill.
Thank you, Madam Deputy Speaker, and it's a great pleasure to speak for the opposition in this debate to mark National HIV Testing Week. We've heard some great contributions today from members on both sides of the House, and it gives me hope that we can continue to make progress on this issue in the years ahead. Thank you to my honourable friends from Warrington North, Worthing West, Strangford and Hammersmith for making powerful speeches on the enormous progress made on HIV. Incredible advances mean people living with HIV on effective treatment can now enjoy normal life expectancy and are no longer at risk of passing on the virus. And the reality of living with HIV in the 2020s is a world away from the 1980s. As colleagues have remarked today, we might just have the chance to be the generation to make Britain the first country in the world to end new cases of HIV for good. And it is an enormous credit to a generation of activists, fantastic organisations like Terence Higgins Trust and many great campaigning MPs across the House and of course the All-Party Parliamentary Group for HIV and AIDS that we have actually got to this point. More treatments have become available. Thousands of people are now living with HIV at levels undetectable or untransmissible to others, and the stigma and misinformation that the LGBT plus community suffered through the 80s is not what it was. And for Labour's part, we are incredibly proud of our record on HIV. It was the last Labour government that switched spending so people could get the new drugs as they became available after 1997. And we passed the Equality Act in 2010 that gave legal protections to people living with HIV. And Chris Smith became the first Member of Parliament to talk about living with HIV in 2005. And in 2018, the Honourable Member for Brighton Kempton was the first Member of Parliament to talk about living with HIV here in the Commons. But there is much more to be done. There are around 4,500 people in the United Kingdom living with HIV who are undiagnosed. The earlier those people can be found and linked to care, the better the health outcomes will be, and the closer we will be to stopping new transmissions. 44% of people diagnosed with HIV in England last year were diagnosed at a late stage. Late diagnosis rates are even higher for women, 51%, and it means some women are diagnosed so late that they are already on their deathbeds. I will.
Honourable Lady is making that important point, women particularly at risk by non-diagnosis. She rightly mentioned some of the Labour people who've made important contributions. We ought to remember Norman Fowler, and we also, if I may say so, I don't normally talk about my wife's work, but when she was Minister of Health or Secretary of State for Health, she got the insurance companies in and said, do not put higher premiums or refuse cover to people who've taken an HIV test. That's not the way to move forward.
I thank my honourable friend for his remarks, and I'm sure he's now put them on the record. There were 13,000 fewer people tested for HIV in 2022 in comparison to 2019. And that is why we've seen cross-party support today for HIV Testing Week. Testing is free, it's quick, it's easy, and you can even test from home. So I urge colleagues to share this information with their constituents as you can order a free test online. Turning now to what government can do to help eradicate new transmissions of HIV, I was very pleased to see the government finally commit to rolling out opt-out testing to all 32 areas of high HIV prevalence in England. The pilots have been a resounding success, and Labour has fully supported bringing them to other high-risk communities across England. The Shadow Health Secretary and the Honourable Member for Ilford North was on the HIV Commission that first made those recommendations. So can the Minister provide an update on progress towards rolling out the programme to the 47 new hospitals? And can she provide reassurance that opt-out testing in emergency departments will be embedded in the long term as a cornerstone of the UK's plan to end new HIV transmissions? We know that receiving a HIV diagnosis can be alarming, especially if you are not expecting it. So can I ask if she has considered setting aside a portion of funding to ensure people who are diagnosed through the scheme are given support to help them to come to terms with their diagnosis? And has she made an assessment of whether opt-out testing could be rolled out in other settings in primary care? The Minister will know that the HIV Action Plan included several commitments on HIV testing, including local authority commissioners setting standards for sexual health services to achieve a 90% testing offer rate to first-time attendees. 2 years on from the publication of this plan, there has been no reporting on its progress. So can the Minister say what progress the Government has made against commitments in the HIV Action Plan to increase the number of people tested in sexual health services? Finally, I want to ask the Minister about the Government's commitment to the prevention agenda. Under this Government, we have widening health inequalities, life expectancy stalling and a record high 2.8 million people out of the workforce due to ill health. Any government interested in supporting the NHS would put prevention front and centre of its agenda. But for 14 years now, there's been no joined-up plan for health, and services and institutions that promote good health have been run down. This week we heard that England's National Public Health Agency, OHID, has been, quote, effectively dismantled. OHID, of course, leads on sexual and reproductive health and HIV, among a wide range of public health issues from tobacco to obesity to children's health. So can the Minister explain how the Government can be committed to the prevention agenda while dismantling our national public health function? And can she do us the courtesy of confirming how many full-time equivalent staff have been cut from OHID? And can she explain why the Government has not had the courtesy to make a statement to Parliament on what has been reported and sounds like quite significant cuts? Madam Deputy Speaker, there has been remarkable progress on HIV that has been hard-won, which puts ending new cases of HIV within reach, and we only have one Parliament left to do it by 2030. So I want to put on record clearly that Labour is committed to getting us over the line, and it's why we would immediately get to work to publish a refreshed HIV action plan. It won't be easy, but we know what it's going to take, and we owe it to everyone we have lost to the virus, everyone who has faced that stigma, and everyone who is living with HIV today to end new transmissions once and for all. Thank you.
Minister Andrea Leadsom.
Thank you, Madam Deputy Speaker. Well, first of all, can I congratulate my right honourable friend for Dumfriesshire, Clydesdale and Tweedale, as well as the honourable member for Warrington North for securing this important debate. I note that my right honourable friend has been called away to his constituency today, but I'm very grateful to him and the honourable lady for their strong advocacy for HIV Testing Week. I'd also like to pay tribute to all colleagues who've contributed today, the members for Worthing West, for Hammersmith, for Strangford, and then East Dunbartonshire and Birmingham Edgbaston as the opposition spokespeople for their contributions. I think what the House can see is that there really is cross-party, cross-house consensus about the need to really challenge ourselves to meet our ambition of no new HIV transmissions by 2030. I'm absolutely sure we can do that if we stick together on this subject. So I've listened very carefully to the contributions, and I will try to answer all questions during my remarks. First of all, I want to start by saying I'm grateful to everyone who's taken part in National HIV Testing Week, and especially to all those who've been tested at Portcullis House, thanks to the work of the excellent Terence Higgins Trust. I'd also like to commend the work of other charities, including the National AIDS Trust, Tackle HIV, the LGBT Foundation, George House Trust, and many others who are supporting families up and down the country. And I also salute the work of the APPG. Madam Deputy Speaker, we should remember how heroic NHS staff stepped up to care for people living and dying with HIV and AIDS in the 1980s, at a time when AIDS was a terrifying new disease that spared no one. And it is to honour their legacy and complete the work that our NHS began 40 years ago that this government made a bold and ambitious commitment in 2019 to end new transmissions within England by 2030. And to this end, we published the first groundbreaking National HIV Action Plan just over 2 years ago. Testing is one of the plan's central pillars, and I'm proud to say we've been making huge strides, setting an example to the rest of the world to follow. So last year, Madam Deputy Speaker, the UK ranked first in the European Combined Sexual and Reproductive Health Rights Ranking Atlas 2020 to 2023 in front of 43 other countries. The UK's Health Security Agency has confirmed that for the third time in a row, England achieved or exceeded the UN's 95-95-95 targets, meaning 95% of people with HIV are diagnosed, 98% of those diagnosed are being treated, and 98% of those on treatment are unable to pass it on. But whilst we've made excellent progress, we are not complacent, and we will not be satisfied until that number is brought to zero. So we've put National HIV Testing Week at the heart of our efforts year on year. We know tailored and targeted campaigns are the most effective, so we've increased the number of tests and we've widened the scope of our campaign, making sure our messaging reflects and appeals to the different groups we're trying to reach, undertaking ever greater efforts to reach those who have been missed before, who have become unengaged in the process. So last year we introduced the option of self-testing with near instant results at home for people to give them more choice and more control over their testing. And this year, we're partnering with local businesses to offer tests in places that regularly serve people from the Black African community, for example, who we know are less likely to want to go for a test. And these efforts have brought results. Since we launched the HIV Action Plan, we've sent out almost 100,000 tests and received over 300 reactive results, allowing us to immediately begin the process of getting vital treatment to those who need it. So far this year, the figures show over 4,000 self-sampling and self-testing kits have been ordered, with nearly 500 results reported back, with 9 HIV reactives. Our campaign's message is simple: I test. Not I test, but I test. And, Madam Deputy Speaker, I'm pleased to tell the House that, like the Honourable Lady for East Dunbartonshire, I also tested this week. So I can say from experience that testing is quick, easy, confidential and free, and I had a good bit of banter with my fellow health ministers as we undertook our testing together. So ours wasn't very confidential, but it was through choice, and we were demonstrating that, of course, it's very easy to do. Everybody should test. It takes 2 minutes to do. Please do it. And our most recent figures show that although new HIV diagnosis rates are steadily decreasing, they do sadly remain disproportionately higher among all gay, bisexual and men who have sex with men, as well as in heterosexual people from the Black African community. And a similar disparity can be found in testing, where despite huge progress and record testing rates amongst gay men, lower levels of testing persist among Black African and heterosexual groups. Now, Madam Deputy Speaker, NHS England has invested £20 million to deliver opt-out HIV testing in emergency departments in areas of extremely high HIV prevalence to ensure that people who need it get the right treatment as early as possible. Anyone having their blood taken in A&E in those centres has been automatically, with the potential to opt out, tested for blood-borne viruses, diagnosing people who wouldn't have been reached via any other testing route. This saves our NHS millions of pounds. It relieves pressure on the health service and, of course, helps to address inequalities in testing. And in under 2 years, the programme has already proved its value for money by diagnosing more than 4,000 people with a blood-borne virus, including HIV, Hep B and Hep C. So the National Institute for Health Research is now investing an additional £20 million to find out how we might go further and faster in tackling HIV rates in the additional 47 sites of high HIV prevalence across England. Yes, I will.
A good initiative, but it's limited by time, it's limited by geography and by the type of institution that's offering the test. Is the government committed to go further than that? and to spread opt-out testing into other health facilities and into other parts of the country?
Well, as I just mentioned, that 20 million additional funding is for the National Institute for Health Research. So, as well as delivering the opt-out testing in 47 centres, it will also deliver a live dashboard of the effectiveness of this type of opt-out testing to add to the self-testing where you can, as we've discussed, order this to be done at home or indeed attend a centre. But what's really important is that the public health grant is used in local authority areas to create their own attempts to reach out and identify those who should be tested. I'm happy to give way.
Can I just say that if we want to reach out again, and I say we, that means this House wishes to have more testing, has the Minister been able to perhaps explore or see if it's possible to do some of the testing and the further outreaches that the Honourable Lady is referring to the likes of the Northern Ireland Assembly, to Scotland, to Wales? Because I think this is a programme of testing that we should all be in vigorously pursuing, and we can do that better if we do that in a collective way.
Well, I completely agree with the Honourable Gentleman. This is something that we would like to see done around the world, and in fact the UK is a major, I think the third biggest donor to the Global Fund, which seeks to eradicate HIV, malaria and TB, and we've donated £5.5 billion. So our interest is in eradicating these diseases around the world, but much closer to home. The Honourable Gentleman is absolutely right. That crucial part of the United Kingdom, Northern Ireland, should also be supported and helped to roll out this testing in Northern Ireland, and that will be able to happen now that the Northern Ireland Assembly has been re-established, for which I'm delighted. So, Madam Deputy Speaker, of course there is still much more to be done to smash the stigma around HIV testing and treatment, and I'd like to pay particular tribute to Becky from Sheffield and Akona from Leeds for recently coming forward and telling their stories to the BBC. They're setting an example for people up and down the country to come forward for testing or treatment. And we're backing their efforts to spread awareness by funding HIV Prevention England's HIV Stigma Symposium in March at the ICC in Birmingham. This event will bring together community experts, activists, healthcare professionals and affected people to discuss the impact of HIV stigma and to look at effective stigma reduction strategies. I'm sure that symposium will bring forward promising stigma reduction solutions, and I will listen very carefully to their recommendations. And I'm pleased that HIV Prevention England are focusing their efforts on giving a platform to speakers from underserved areas. Of course, HIV prevention goes beyond testing, and the use of pre-exposure prophylaxis, commonly known as PrEP, is an important part of combination HIV prevention. It's being called a miracle drug to prevent HIV-negative people from acquiring the virus, and it's a vital tool in our battle to end new HIV transmissions by 2030. Oral PrEP has been routinely available in specialist sexual health services since 2020, but we recognise, however, that there are challenges for certain groups to access the PrEP that they need. So that's why we've developed a PrEP roadmap with colleagues from government, local authorities, professional bodies and the voluntary and community sectors that we will be publishing on the 15th of February. That's a week away. I will.
But specifically on that point, the average wait to access PrEP at the moment is more than 12 weeks because it can only be got through sexual health clinics. And sexual health clinics have seen a real terms cut in funding of about 30% over the last few years. So will she either increase the availability of resources in clinics or increase the number of outlets, for example pharmacies, where PrEP can be obtained? Because this is where the logjam is occurring.
Well, as I've just said, the access to PrEP is exactly why we've developed a PrEP roadmap that will be publishing its report in a matter of a few days. So I would encourage the Honourable Gentleman to look at that. But I do want to thank everyone that has played their part in drafting that roadmap, working tirelessly towards our 2030 goal of zero new transmissions. And I also want to thank all our partners for all their support. First, in the promotion of HIV testing through National HIV Testing Week. Second, for our sexual health summer campaigns. Third, for the rollout of PrEP throughout the country. Fourth, for the introduction of opt-out testing. And fifth, for the development of a PrEP access and equity roadmap, as well as so much else besides. And Madam Deputy Speaker, these results wouldn't have been possible without Kevin Fenton, the Government's Chief Advisor on HIV and Chair of the HIV Action Plan Implementation Steering Group. His bold leadership has brought together partners across the health landscape towards our shared goals, and I want to pay particular tribute to him. So many of us have a part to play as we reach the end game of ending new transmissions of HIV within England by 2030. So, Madam Deputy Speaker, I want to finish up by reiterating my sincere thanks to all colleagues across the House who've shared stories and advice and experiences to support our efforts over so long. And I hope that the debate we've had today will inspire thousands of people to do the right thing and take an HIV test. Thank you.
Charlotte Nichols.
Thank you, Madam Deputy Speaker. I thank all those honourable and right honourable members who have made such thoughtful contributions today. I want to thank again the Right Honourable Member for Dumfriesshire, Clydesdale and Tweeddale who secured this debate for giving us this opportunity. This cross-party consensus around the importance of HIV testing and the tone in which today's debate has taken place represents the very best traditions of this House. I hope all of those listening will consider taking a test to know their status and look forward to continuing to work with members of the APPG on HIV and AIDS to hold the government to account on their progress towards the 2030 target.
Thank you. The question